This is the Components of Quantitative Analysis series, an introduction for clinical investigators. I'm Michael Rosenberg, an associate professor of medicine in the Division of Cardiology in the EP section of the University of Colorado Anschutz Medical Campus. This is part one of the series, What is a Model? So if I was to diagram healthcare as a process, I would start with the patient and the provider and an exchange of information between the patient and provider. Another way to think about the patient in terms of data is a longitudinal data generating process. The patient goes home, lives their life, generates a bunch of information about their health, risk factors, goals, and then they provide that data to the data processor, which is the provider, who basically takes a sample of the data when they see the patient and then applies some model. And then from that model, they deliver results, which can be advice, treatment, counseling, various different entities. And then those are returned back to the patient for an ongoing longitudinal data generating process. Now, if we stop and think about the data sample, this is sort of the input information to a model. We kind of think of this as the X variable. So, again, this can be your history. This can be a longitudinal subjective description from the patient's sensing organs. This is how we get the history, what they're sensing, what they're experiencing. We have the exam, which we consider cross-sectional objective. It's an inspection of their biology and physiology. We take their vitals, again, measurements of their different physiological markers, and an association of labs and studies that is cross-sectional objective, basically an assessment of their biology anatomy. So this is sort of the data sample that we can think of being provided to us as the data processor or clinician or provider. If we think about this, kind of putting it into a framework, so we have our data sample X. Our model is we do something with X. So we take all that information and we apply some function. We do something to that data to produce a prediction, which we can think of as the Y variable. So we basically take X, put it into some, algorithm in our head or potentially explicit, and then we produce some prediction that we deliver as the results of treatment advice. So if we think about this in terms of a model, this is sort of what the model is doing. We're basically taking information as a predictor, X, and we're producing a predicted value, Y. And again, we can think of a model as any function. And again, this is using the term function very broadly here that we apply to those inputs to produce the output. Patient says chest pain, that's the X is them saying chest pain. Our output is order ECG. The function is this association. If I hear chest pain, I order the ECG. Of course, these can be different values. Y can be the risk of a future disease. We call these risk prediction models. It can be the probability that you have some disease, prevalent disease at the time that they're giving us the information. We call these signal detection models. It can be which treatment should be applied based on what they've told us. We call these policy models. Or it can be an estimate of their overall health and wellness. We think of this as kind of a reward model. F of X, the function we apply, again, can be a wide range of things. This can be a set of rules, both explicit or implicit. It can be a linear mathematical operation, such as a regression model. It can be a nonlinear mathematical operation, like a deep learning or machine learning model. Or it can be just random selection. We can flip a coin. You give me this information, I flip a coin and produce the outcome. Again, this is the function that we're referring to, that it's applied to the inputs. Of course, all models, this famous sort of saying, all models are wrong, some models are useful. And the reality is the value of a model is completely determined by how it is used. So again, I can create a million models out in abstract space, but if I'm not going to, figure out how to use it, it's not going to be particularly useful. And again, we use, models all the time to guide decisions, and not just in healthcare. There's weather prediction, should I wear a raincoat? Maybe the inputs are the weather, report on my phone, looking outside, economic models. Should I do something different with my money based on, a set of inputs? health models, which we'll obviously talk about in a lot of detail in this series. Should I start a medication or not? Policy models, which again, I talk about policy both as a decision, sort of component of the decision process, which we'll get into a lot more detail. But there's also sort of government policy, high level policies. Should we change the laws or codes? And of course, I think of as research models, should we study the biology of this protein? Again, if you're a basic science researcher, you have your inputs are some of the, results from a set of experiments. And the question is, should we move forward with this? You can kind of think of this as an ad hoc research model. Um, I think it's important to think about these as far as the use, because again, we can create models all day long. There's this idea of something called navel gazing. I'm just putting a bunch of data together to create a model that I would never actually use to do anything with. So again, I think it's always important to ground the model itself is why are we doing it and how are we actually going to use it. Um, so again, kind of moving from abstract models to, well, when do we want a quantitative model? Again, now we're sort of talking about models with data. And again, we use these all the time, rules of thumb, they're called heuristics. These are the most common models, obviously. But the problem is, of course, they're not always consistent. We don't always maintain internal consistency, depending on our mood and, a number of other factors. They certainly don't lack, they lack transparency. It's in our head. We often don't even know why we're doing some of the things we do. Of course, they don't have a systematic method for updating. I mean, it could be anecdotal, it could be the last experience. Again, we don't, if the model we used was wrong, we don't really have a systematic way to update it to be right more often, or certainly, not consistently. So, on the whole, these are, generally more unreliable. Although, as we'll talk about, they also, the human brain is a pretty sophisticated, entity, so certainly can come up with more complex sort of functions than you probably could do using a computer. But for the most part, we want quantitative models that use data and numbers. Again, the idea here is that they're consistent. They're generally transparent, sometimes more than others. Ideally reproducible, and of course systematic. In general, if I put the same numbers in, I should get the same result out each time. Again, the quality of a quantitative model is, highly dependent on the data you're putting in. There's this sort of adage, garbage in, garbage out. So if we're building a model that's based on, lousy data, then we're going to probably get lousy predictions from it. And importantly, it depends on the framework. What do we care? Do we care about what's being modeled? And different assumptions around the model. So, again, the goal is moving from something that's unreliable to something that's more reliable, predictive, systematic. With a number of other reasons that it's certainly not perfect. So when we think about the goals of quantitative models, I generally break these down into two broad categories. The first are we want to predict an unknown x if we have a given, or sorry, an unknown y if we have a given x. So, we're given a set of inputs and we want to know, some output. We're given the weather today. I want to know whether it's going to rain. We're given a patient's, risk factors for atherosclerotic disease. We want to, predict whether they'll actually have it or not. Again, the goal here is to predict y accurately, and we'll talk about that in a little more detail. Um, Alternatively, sometimes we care more about the x's. We actually want to know, inference. We want to know which x's were more important in, predicting y or causing y to occur. We call this, causal inference is a whole field of quantitative analysis where we really want to know, which x actually leads to y, versus which ones might be just associated through some confounder or another, intermediary. Um, in theory, a perfect model could do both. Again, models take X, predict Y through some function. So if it's a perfect function, we would know exactly how X leads to Y, and we would also predict Y accurately. And of course, we would ideally want to do both. It turns out in reality that we often have to relax one for the other, depending on, a set of assumptions or, particularly how we want to use the model. And we'll talk more about some of those things as we move along. Um, so as far as predictive models, here again, the model is focused on making accurate predictions, and I think a good example of, of classic, just purely predictive model is facial recognition. We have a picture here, we apply our model, probably some deep neural network, and we produce the probability that that face on the picture is Emily. And we have some probability, metric for that. Again, applications based on the prediction from the model, for a lot of these models, we don't really know what it's using to identify Emily. Obviously, people try to uncover that, but at the end of the day, when I, for a facial recognition to unlock my phone, all I really care about is that it can recognize me and unlock the phone appropriately. So again, your focus of this is the prediction here. It's not necessarily which part of the image, which why or how did it take this specific image and produce the probability of Emily. A good example for this, for healthcare applications are some of these models for mortality prediction. Again, I think about this for inpatients, but it's important to think about how this model would be used. Again, the number from the model, which is a probability of death, it could be useful if it's triaging patients, if it's informing hospice decisions, if predicting that a person has a high probability of death within the next 6 months, then they would, qualify for hospice and all the resources there. And as well as just to prepare the patient, family, there may be a bad outcome coming. Again, really not that useful for clinical decisions unless we know exactly how that prediction was made. So if I have a deep learning model and I predict that a probability of death is 45%, if I don't really know, what was involved, I don't know how to, adjust it. I don't actually know whether, some of those inputs might have been mismeasured. Again, I think for making decisions, these models aren't particularly useful, but certainly, if you're for mortality prediction, there are sort of applications if you're using just the prediction itself to make decisions. In converse of those, are our models of inference. So these are probably the ones that most people are the most familiar with. These are sort of models to understand, with a why or how. They're trained to predict some entity. Again, they're not, models are all trained to predict something, but here the focus is on the reason that their prediction occurred. It's really on the inputs. It's not on the output. It's not on the why. And the classic example of these are the proportional hazards models. You'll see these are widely applied in clinical trial evaluation to compare treatments. You're looking at, what's the hazard ratio that results from these analyses is what's the relative effect of treatment A compared to treatment B. Again, these are the inputs to the model, treatment A and treatment B. These aren't the actual predicted, mortality rate. I mean, you can get that from these studies, although it's often affected by censorship and other factors. But ultimately, the model itself is just caring about this one comparison. Again, it's an inferential model. We care about the inputs more than we care about the outputs. So finally, just kind of thinking about these in terms of healthcare decisions, it's important to keep in mind, healthcare decisions are mostly based on models. Again, it can be explicit or implicit. It can be qualitative or quantitative. What I'll hopefully, get people thinking about with this series is that a lot of qualitative models can actually be converted to a quantitative model if you have the data. And that's often what this whole idea of evidence-based medicine is focused on, is taking things that we think, or observed might be effective in, from qualitative experience, and then actually performing a quantitative analysis to see if they actually do, if the numbers support what we're doing. Predictive models can be used to guide the healthcare decisions. So I don't want to say that just having a predictive model is not useful. But again, it's important to choose the option associated with the best predicted outcome. Again, it's still going to be tied to some action. Just having an omnibus, you've got a 75% chance of death in the next year isn't very useful unless we kind of plan to do something with that result. So again, I think it's important for predictive models to think about exactly how it would be used to guide decision making. Again, inferential models are something that we've been using for a long time to understand biology. Importantly, these are often, used to study decision makers. It's important to think about what level you're actually studying. Certainly we study models to say, why did a certain patient develop disease? I think more frequently we're starting to look at models that say, well, why were certain patients treated differently? Sort of models of health equity, fairness. So again, I think that, these are the why, what is it about the inputs to these models that is the interest, and ultimately the first decision for any model is how do I plan to use this model? And I think that's the overall message from this first part is when you're making the model, the first thing you should be thinking about is how will it be used? And as we move forward, that'll come up because it's easy to get overwhelmed by all the different functions and mathematical, functions and different things like that. And along the way, at the end of the day, the most important thing is how would we use it? And hopefully that'll be the take home from this first part.